Hello, I'm Melinda Torres, and in this video we will show you a few important alcohol-related measurements: ABV, proof numbers, and BAC. So let's get started. ABV stands for alcohol by volume. While this might sound like some term you find in a textbook, the concept is actually quite simple. ABV is how much alcohol there is in any given drink. Typically, liquor has a higher ABV than wine, and wine has a higher ABV than beer. On average, liquor is 30 to 50% ABV, with 40% being the most common alcohol by volume percentage for liquor. Wine ranges on average from 12 to 15% for most wine, and most beers are in the 4 to 7% range. That being said, sometimes products contain more, so be sure to check the label to find the ABV for a product. Since the percentage of alcohol varies for different types of drinks, the standard drink size of each type varies as well. For beer, the standard drink size is 12 ounces. For wine, the standard drink size is 5 ounces. And the average drink size is 1 to 1.5 ounces for liquor. Of course, this is based on standard alcohol content beverages. As you may have noticed, some liquor is higher proof. So then, what do those proof numbers mean? Well, the formula is simple. Just take the proof number and divide it by 2 to get the alcohol content by volume. So 80 proof alcohol is 40% alcohol by volume. If a drink is 40 proof, it's 20% alcohol by volume. If it's 100 proof, it's 50% alcohol by volume, and so on. Obviously, the higher the ABV or proof, the more the alcohol affects you. The level of alcohol in your system is measured with BAC, which is blood alcohol content. The more alcohol you drink, the higher that your BAC will get. The way that alcohol affects your BAC is impacted based on several factors, including height, weight, and sex. Typically, the shorter and less you weigh, the less alcohol it takes to increase your BAC. Likewise, women's BAC raises higher than men's BAC when drinking alcohol. Although there are charts which can estimate BAC based on height, weight, and sex, and the number of drinks you've had, other factors such as how much food you've eaten, alcohol tolerance, and various unmeasurable variables can affect the actual BAC, which varies from person to person. Still, we've included a BAC chart in this module for reference. Hopefully this information provided clears up some confusion regarding the common alcohol measurements. Remember, ABV stands for alcohol by volume. It's the percentage of alcohol in an alcoholic beverage. Proof numbers are always twice the ABV, and BAC stands for blood alcohol content, which is how much alcohol you have in your system.